Welcome to the Beauty of Breathing podcast, where we explore the wonders of optimal breathing. I'm Renata Nehme, a dedicated mom, entrepreneur, and myofunctional therapist committed to embodying the principles I advocate. Having recently undergone a tongue tie release and palatal expansion, I'm thrilled to guide you through the transformative journey of embracing the beauty of breathing, effortlessly and through your nose. Let us know how much you enjoy the show by leaving us a review. Hello everyone, and welcome to another episode of Beauty of Breathing. I'm over here with my dear friend, Dr. Rafif. How are you?
Hello, how are you?
I'm doing great. Let's go live on Instagram too.
I want to put my airplane mode. Perfect.
All right. Well, we are so honored to have you here with us today. Thanks for accepting our invitation. So I'm going to introduce, of course, I'm going to introduce it to everybody now. I'm going to introduce the topic after, and then we can start. So presenting Dr. Rafif Tayara, a leading pediatric dentist and sleep dental medicine specialist trained at Tufts University, and a top 1% Invisalign first provider in Dubai and the Netherlands. She's the founder of Junior Dental and the Pediatric Academy and was voted Best Pediatric Dentist in 2025. With experience across North America and the Middle East, she focuses on modern pediatric dentistry, early airway orthodontics, and myofunctional therapy, working closely with a multidisciplinary team to support healthy growth in children. She's also the author of the children's book, Danny and Sarah Go to Dr. Smile. I have it here. I should have brought it out. A proud mother of 3, Dr. Tayara is dedicated to helping children breathe, grow, and smile better for life. The topic today is Growing Faces Beyond Teeth, the Pediatric Dentist's Guide to Sleep, Growth, and Development. Thank you so much. And we got to see each other in Dubai not long ago. That was incredible.
Yeah, it was a beautiful visit. Thank you for the beautiful introduction. Yeah, it was nice having you for a couple of days in Dubai.
Oh my gosh, I cannot wait to come back. It was absolutely amazing. And again, my heart's with you guys. I know it hasn't been easy. We were just mentioning that schools are still closed. They're doing online learning. I can only imagine what that may be like for you guys. Is it starting to get better?
Maybe a little bit, but yeah, hoping that will be solved soon, and we all go back to normality.
Fingers crossed. I had another interview with Airway Circle the other day, and it was somebody that was in Israel. So again, he's like, I hope the sirens are not going to go off, and we have to run to the bunkers. And it's crazy because in America, we really have no idea what that is like. And usually in Dubai, you don't either. So for you guys to be going through that, it's, our heart is with you guys.
Thank you.
But let's go ahead and start our topic. And I'm probably saying your last name wrong. Can you say it for me?
What is it?
Your last name.
Tayara, no? You pronounced
Tayara,
it.
I said it right. Good. Dr. Tayara, as a top 1% Invisalign first provider, trained at Tufts and founder of Junior Dental, what inspired you to specialize in pediatric dentistry and sleep dental medicine across North America and the Middle East?
Oh my God, it's been a journey. I've been a pediatric dentist I started my journey in pediatric dentistry 21 years ago. Oh my God, I feel old. It's been a while. I have started a training in pediatric dentistry in Montreal, Canada, and a big part of our training was also early orthodontics. And this was my first kind of encounter with, growth and development of children. But then slowly, through the very first years of my career as a pediatric dentist, I noticed that there was a cycle of relapse of early childhood cavities that I was seeing when I see children coming back for their 3-month checkup, 6-month checkup. And I noticed that a lot of the reason why those kids were having relapse of cavities was actually mouth breathing and sleep disordered breathing. And this is where I realized that there's so much more to understand. And I think that was a shift in my practice where I stopped treating teeth. I stopped, drilling and filling, and I started understanding more the root cause of the problem. And I feel that at that point, I started really that shift to what I called modern pediatric dentistry, where I'm not just focusing on root canal treatments and pulpotomies and crowns, but I'm really focusing on, what's causing, this disturbance of the oral microbiome of a child, of, understanding how he's breathing. I started really zooming out basically on children and checking their faces, how they're walking, their posture, their swallowing, everything, and really understand what caused this whole thing in the first place. And if you really dig into pediatric dentistry, you really understand that actually a lot of the foundations start in the very early days, when the baby is born. And this is where the problems, always start. That's why the best focus is to really bring, pregnant women and do the counseling and really see babies in the very first few months when they're born, to understand this whole thing. So this is where really the whole shift started. And then, the journey started to understand more, sleep dental medicine. And if you also see, like, even the programs of sleep dental medicine have evolved so much, right? And back in the days, we didn't really have the references and the programs and the trainings that we've had now. I mean, we're so lucky now to have so many mentors around the world and trainings and programs that kind of guide you through that.
The name of this podcast is The Beauty of Breathing. What does the beauty of breathing mean to you personally?
I've had my own personal journey with breathing because I'm also, a chronic mouth breather, and I've suffered from allergic rhinitis for many, many years, still until now. I have a lot of family members who, snores and, suffer from sleep apnea. So it was more of a personal journey for me, other than, understanding it for my patients and trying to treat and help people around me. But for me personally, throughout my career, I feel like breathing is much more than survival for kids. It's also architecture. It's also the way, it shapes their face. It's more of the way breathing shapes their teeth, their face, their jaws. So that's what really breathing is all about for me.
I was just at a Bible study right before I got here, and we've been talking about emotions and how to handle our emotions. And we all know, we're also moms, it is so difficult to learn something that we didn't learn whenever we were kids and actually be able to pass that down to our children. Last night, Benny, I was really upset. And, I was about to go, stop crying, like, it's fine, just cut it off. And then I caught myself and I looked at him and I was like, name it, name your emotion. And he thought about it for a second and he looked at me and said, mad. And I was like, good, it's okay to feel mad at times. Anyways, in the Bible study, somebody mentioned that one of the ways for us to help with anxiety and things of that nature are breathing.
Yes.
And then I was able to share with them a couple of breathing exercises and how it's related to our sleep and to our health and everything else. I mean, vagus nerve and, everything that we know now in the professional world of Airway that is related. Why do you feel mouth breathing is still so overlooked in children today?
I think it's because it's very silent, right? It's not something that screams out loud. And I think a lot of the things that we do at at my practice, at the clinic, and also on social media is raising awareness. So I feel the more we educate parents on the red flags, right, on what to see, what to look for. And a lot of times when I'm talking to parents, and then I'm trying to, I'm describing, right, the consequences or the impact of mouth breathing or sleep disorder, what happened is that they tell me, "Oh, you're describing my child. It's like you've been with us at home."
Yeah.
Or I also hear the mom tells me, "Oh, but I've lived with that all my life." Right? So you notice that the mom or the dad have had that experience all their lives, and now they're seeing their child going into that same vicious circle. And now that they're hearing you talking about it and the impact on the quality of life, on the concentration span, on even like the school records, right? They feel that now they're accountable to break that cycle and to fix it. And it's really funny that what you're saying about breathing for Benny, but one of the main tricks or behavior management techniques that we learn in pediatric dentistry is when we feel that the child is anxious, we tell them, breathe from your nose or take a deep breath. And especially when we do sedation with the happy gas, this is one of the techniques that help me calm the child, by asking him, take a deep breath, breathe from your nose, use your nose, because often when you're anxious, you forget to breathe from your nose and you start hyperventilating from your mouth. And just reminding the child, to use their nose, that, you have to breathe from your nose and not from your mouth, actually puts him in a calming, environment again, and allows you to have a more of a positive experience, and allows him to gain more, to regulate his emotions better. So this is one of the most simple tricks in pediatric dentistry, but it works like magic.
I love it. Who over here has a child with big emotions? If you guys do not know, we do these Beauty of Breathing podcast recordings live. So if you're listening to us live right now, write in the comments, who over here has a child with big emotions? That's another conversation that we had this morning. And I tried to then, I had to bring it over to our Airway side. I said, a lot of times these children that are not breathing properly, that have bad posture, that have crooked teeth, that have a stuffy nose, it will keep them in this fight or flight instead of the rest and digest. So their sympathetic system is super heightened. They have way more cortisol. So every little thing, even if it's something like I grabbed this from here, there was Benny's and I put it here, and he's freaking out. All of a sudden, like, they're big emotions. They feel big emotions. And we always have to ask ourselves, is this child constantly on fight or flight? Because they're going to snap. They're going to react way more than a child that feels safe, that has a little bit lower cortisol throughout the day. Can you talk a little bit about what are some signs that seem normal to parents? Because as a mom, I'm like, he's just like that, My child just has resistance to change, which I know it has to do also with reflex integration. He just explodes. That's his personality. So what are some other signs that seem normal to parents, but they're actually red flags?
So one of the things that we hear a lot, and that actually makes you think that, it might be related to their sleep or their breathing, is when parents talk and say, my child is difficult, or my child cannot sit still, or my child, bedwets. And sometimes you're talking about a child who's like beyond 5 or 6, right? Or wakes up so many times at night, right? He goes to the bathroom at night, that their bladder is just out of control. And those are often kids that aren't difficult. They're often kids that are just sleep deprived. And once you fix, their sleep cycle, once you fix their breathing, they come, you actually see that there are no more dark circles under the eyes. You feel that their face is like lighting up. You see the pink colors on their faces, throughout the treatments. And we know today that a lot of those symptoms mimic ADHD. And I'm always pushing with my team of myofunctional therapists and psychologists and psychiatrists to please send us those kids before labeling them with ADHD, because maybe we can help, we can maybe reduce the symptoms. I'm not saying that the ADHD diagnosis might completely disappear like a magic trick, but often it helps a lot with them regulating their emotions, with them, because those symptoms are, they mimic each other.
I think that it's become so common for people to have crooked teeth. Can you talk a little bit about why do we see more teeth misaligned today? And why aren't we looking at these children or adults with misaligned teeth and thinking like they are not fully healthy? Even people looking at themselves, they think it's just normal. But what are some things functionally that could be happening that they don't even know because their teeth are misaligned?
I think one of the like takeaway messages, if any parents are watching us today, is that we don't grow into our genes, we grow into our habits. So one of the I feel the most powerful things for a new mom to know is that the habits that you're gonna build your child on are really gonna be a contributor or trigger factor into building their faces and shaping their faces and their breathing. So I know that we talk a lot in pediatric dentistry about pacifiers and thumb sucking, but we see the damages done every day, because it's not just the flared out teeth, or the buck teeth as we call them, that are just the consequences. And just a lot of parents, they say, oh, you know what, it's okay, you're just going to have buck teeth now and then we're going to fix it later with braces. It's not just that. The damage goes much more beyond that. Pacifiers that are used for a long time, with a lot of frequency, with a lot of suction power, what they do is that they force the tongue to go down, right? And they change the swallowing pattern, they change the way the child uses their tongue, and they make the tongue muscle super weak. But not only that, they actually stop or they inhibit the chin from also growing. So what you see in those kids is that you see them at 3, at 4, and you see them, they have a very retruded, they have a chin, going back, that is kind of underdeveloped, and the palate is so narrow and high arch. And this is already a very poor infrastructure for their breathing, and we have to do so much to catch up with their growth later. So the first pillar, right, of growing well with good habits is really ditching the pacifier and the thumb sucking soon. I'm not saying it's it's easy, but it's something, when you're aware of it, it's very good to have it. And the second thing that I want to talk about that also shapes faces very, very early, and why we have more crowded teeth today, is our food. And if you look at our industrialized food, we really live now in a world where we really depend on highly processed, modern, soft food. And I feel today that children, they don't chew anymore, right? I mean, a big part of your treatments, Renata, is just giving them, hard pieces to chew on, right? Just to train those muscles back. I call it to my patients, we're taking the tongue and the face to the gym. And you feel that those muscles have been dormant for so long in so many of our kids' patients. So a piece of advice for parents watching us tonight is that please don't be afraid of, moving slowly from purees and mashed food to small pieces, and giving the chance to your baby to chew on pieces. And you would be surprised. Babies and toddlers, they have such a big reflex. They are able, those gums are so strong, they can chew big pieces on them. So don't be scared that they're going to choke, of course, within the limits, but be brave and give them small pieces to chew on, because you're training their face you're taking their face to the gym and you're allowing them to have a lesser chance of having crooked teeth.
What do you as a pediatric dentist recommend for pacifier use, since you mentioned pacifier?
So ideally, we want the baby to stop their pacifier by 6 months. This is really the window, that you wanna stick to. Another advice that I usually give parents is not to grow the size. Pacifiers in the market, they do stage 0, stage 1, stage 2.
Mm-hmm.
The best thing is to stay on the first stage and not to grow, because the more you grow stages, the more the nipple of the pacifier grows bigger. And another advice would be just to limit the use of the pacifier only to soothe your baby to go to bed, and not letting him be dependent on that pacifier all night. So I think if we kind of stick to those tips, you would be able to wean him off early, and not to allow to the pacifier to cause a lot of damage.
Very good. How can a child look perfect? Meaning, when they smile and they're young, they have this beautiful straight teeth without any spaces in between them. So they look perfect on the outside, but still struggle functionally. Can you talk a little bit about how is a young child supposed to look in terms of their teeth?
Yeah, so a lot of parents come and tell me, oh, my toddler, has no spaces between his teeth. All his teeth are aligned and straight. So
Perfect.
this is a huge misconception, because straight teeth don't always mean, a healthy smile.
Mm-hmm.
And often what we want to see in a toddler or a child's face is like good, good, strong cheekbones. We want to see spaces, right, between baby teeth, and also between teeth if they're on a mixed dentition. So if they have a mix between adult or grown-up teeth and baby teeth, you want to see some spaces showing, because the more spaces you have, the bigger the jaws are. This means that the face is growing in the right way. And you also want to see, a kind of a straight face, right? You don't want to see a chin going back, going to the back compared to the rest of the face. This is always a red flag. So those are a few things that you want to, raise awareness, among parents. So big spaces between the teeth, big cheekbones, and more of a straight face than a chin going to the back.
You say that this starts earlier than most people realize. How early are we talking, and what can we do when moms realize, okay, my baby is snoring, or they're mouth breathing at night, or they move around a lot, or children that are still bedwetting, kind of at an age where they shouldn't be anymore. When moms start realizing that maybe my child has an airway issue, what can they do?
So I always tell parents that, we need to start putting the pieces of the puzzles together.
Mm-hmm.
And that's why it's so important to see them super early. And we're talking the first very few months of life. We want to see if the tongue is functioning well. We want to see if the jaws are growing properly. We want to see the swallowing pattern, right? If the tongue, they can swallow properly. And we want to be able to surround them with that network of healthcare professionals that can help them. So often what we do is we do an airway assessment, right, with an ENT. We check for their, if there's any allergies, right? Adenoids, tonsils, if there's any fluid in the ears. And often, because even when kids, for example, who remove adenoids or tonsils, right, or they fix the fluid in the ears, we see that 80% of those kids, they come back. Yesterday, I think I had a patient who did 2 removals of adenoids and tonsils throughout 5 years. So, and still she was snoring. She had sleep apnea that was, diagnosed on a sleep test. So this only shows you how much is the power of myofunctional therapy and stimulating again the growth of the jaws. So even though we treated the adenoids, even though we treated the, we fixed the tonsils, even though we relieved the airway and the obstruction in the airway, there will be no positive outcome long term if you don't fix the other pieces of the puzzle. And this is something that we see every single day. And that's why this is not a one-person job. This is a big network of healthcare, professionals that work, that surround the child and make sure that every, every item on the checklist is ticked. So often we do the whole airway assessment. We check the back basically, and then the front, and then we guide the growth, and then we work that tongue out. And this is the only way to have a long-term stability and a positive outcome in a child.
Let's make a very simple and clear list of signs, the top signs, warning signs that parents could be seeing in their children. So I'll say one and then you say one. Deal?
Okay.
All right. So mouth breathing.
Snoring.
Okay. Bags under the eyes.
Tired eyes.
No spaces in between their teeth if they're little.
Chin to the back.
High vaulted palate.
Yeah. Narrow, maybe. Narrow palate.
Chewing with the mouth open.
Gummy smile.
This is getting harder.
Tongue thrust. Maybe we should explain what tongue thrust is. Yeah.
Go ahead.
Maybe you do that.
Okay. Tongue thrust could mean that the tongue is pushing forward when they are eating or whenever they are speaking. So if you see your child talking like this with the tongue in between the teeth, or whenever they swallow, you notice that they push the tongue forward. That usually means they have atypical swallowing, or it's dysfunctional swallowing. But most times, from my experience, upper jaw is too far back.
True. And one of the things actually that one of the signs where I catch a tongue thrust, if I don't do an exam, just by the history, is when parents tell me that they just gulp the food. They don't actually chew the food, but if your child, you feel that he's just like, swallowing the food without like chewing properly, this is already a red flag. So you should investigate.
100%. Let me see if I can think of another one right now. Right in the bed until, or past 5 years old.
It's true. Waking up a lot, during the night, for no reason. Like you can't really find a reason.
Night terrors.
Night terror. Sleep talking can be a sign.
Let's see. Not doing good in school. So the inability to focus in school or retain information.
Yes, a child, who cannot sit still, right? You feel that he's just always agitated. Or sometimes also what my patients report or moms report, they tell me that, for example, their kids, even though they slept 12 hours, like, in one shot, they still wake up tired. They still feel that they're waking up. They don't have a lot of energy. This is also one of the signs.
Or if they wake up at 5:30 a.m. and they're ready to go, but then they crash at 7. So every child is going to have different symptoms. You may see one that wakes up tired and the other one that's up at 5:30, high cortisol, ready to go.
Very true. Very true.
Those are great. I think it was a good list. That was awesome.
Yes.
What would you say to the parent who feels something is off, but keeps being told they'll grow out of it?
I say to them to follow their gut feeling, right? And moms can really relate to that, right? Sometimes you're told a lot of stuff, but it doesn't sit well in your stomach. So just investigate, dig deeper, get a second opinion, read more. And I think you'll find someone who can listen and, act on it.
What role do modern habits like screens, soft diet, lifestyle play in what we're seeing today, specifically to bad posture? Are we unknowingly setting kids up for dysfunction?
That is very true. Actually, I did a podcast 2 weeks ago just about that, and we were talking about how blue screens, today are really disrupting the sleep cycle of children. And one of the biggest thing that we can do for our kids is really delay the time between screens and sleep, and giving them what we call a healthy bedroom hygiene or sleep hygiene. And a sleep hygiene is all about being away from screen, limiting screen time for your children, allowing them to be outdoors a lot, fixing the temperature of the room, the humidity level, the moisture. Especially in Dubai, we have a lot of mold in the walls of bedrooms. So sometimes using a dehumidifier, a purifier. Also one of the things that I always talk every day to patients about is really removing all kinds of soft toys and bumpers around the cots and cribs. We're really surrounded by a society where we're such a consumer society, right? So we have this tendency to just buy sometimes so much unnecessary things to the bedrooms of our kids just because it's cute. But at the end of the day, this all stuff their noses. So it's a lesson that I learned also later in life, to be super minimalistic in the bedroom of a child, because the less you have in their bedroom, the more you allow them to breathe better.
Yes.
And one more trick I always give parents is to use those. Those are my favorite. I also use them with my toddler. Is the saline syringes.
Yes.
I love those. And you see so much coming off from the other side. And I feel that giving that to toddlers, because they have so many, they have such small lungs and such small airways. So really clearing them on a daily basis, especially when they go to nurseries and to schools and they catch, viruses and lots of contamination every day. It's so important to clear their noses on a daily basis. So make it a routine. I know a lot of moms tell me, oh, he's very fussy. It's going to be a fight. He's going to hate it. He's just shouting. But trust me, I've been there, doing it step by step and being so consistent in doing it every day. Yeah. My toddler asked me to do it now. She's like, oh, I want to make my nose happy. She feels better. She's breathing better. And then she understands now the importance of it. So just be consistent. It just takes a little bit of patience, just so you overcome that step, and then it becomes magic.
It's so funny how our kids start being aware. And that's the step one of my functional therapy, is bringing awareness to these things. It's funny, Benny also says, my nose is not breathing right. I want my nose to breathe like Zoe's, because he has way more allergies than she does. I do have a video of him when he was about 1, where I teach how to do the nasal hygiene with a syringe. And I'll describe a little bit here for whoever is listening. I usually grab a bath towel and I wrap around him. It's like that his arms are not going up. He's on my chest and I hold his chin. You guys got to make sure that you're using distilled water or bottled water. It cannot be water from the sink, please, because you can introduce amoebas and all of that, brain-eating bacteria, all that crazy stuff. And then I had a packet that I used to buy of saline. I put that in the water. And you fill up the syringe and it just goes on one side, the other side. Do not lay the child's head too much to the side, because you're going to get water to go into the ear. I've had it done I did it myself, and it was the worst headache I've ever had in my whole life, all night long. I thought I was going to have to go to the ER. It was so bad.
Yes. And we should always tilt the child of the head a little bit forward. Exactly. And the direction of the syringe, it should be towards the septum. So that means towards the midline of the nose. So
very good.
Those are the little tricks. Yes.
I used to wake up in the middle of the night. Like if they were sleeping next to me and he wasn't breathing right, I would literally wake him up, take him to the bathroom. He didn't like it, clean his nose and put him back to bed. The quality of sleep that he got after that on the last few hours was so much greater than I had gotten in the first part of the night. So it's totally worth it. I do have an interesting fact about me that a lot of people know. When I got pregnant with Zoe, I did buy a crib and all of that stuff, a beautiful, perfect room. Zoe never, ever, ever, ever slept in her crib, ever. So I kept the crib for whenever I was going to have more children. I lost 2 babies in between Zoe and Benny. And then one day I said, you know what? I can't stand having this in my house anymore. I need room. We got to clean out. I sold the crib. It was literally like a month after I found out I was pregnant with Benny. I never purchased a crib for Benny. He had a regular bed from the time he has a full-size bed from the time he was born to today. And he slept with me most of his life, but never bought a crib. So there's so many things that society tells us that we need that, True. Like they were saying, he didn't need a crib. Something else I wanted to say about the stuffed animals. He does love stuffed animals. I recently saw something that I'm going to purchase for his room. And if there's any parent over here, because I had made a child cry one time. I was seeing a patient for initial consultation, and she could not breathe to save her life. And then I asked the mom, are there any, stuffed animals in the room? She's like, yeah, she has so many. And I was like, well, we're going to have to find something to do with them. And she just busted out crying and never saw me again. I was like, I'm so sorry. But, anyways, it's this tube. It's a clear tube that has like a cute feet and a cute head on the top. And you put all the stuffed animals over there so it doesn't take a lot of room. And they're in this big tower so they can still see them. Maybe once a night they can pick one, you know what I mean? But I cannot wait. I'm going to post as soon as I purchase that for Benny. I'm super excited about that. Oh my God. Yesterday. So yes, yesterday he slept in his room, like I said, all night long without coming to my room. He came to and every night I'm always blowing his nose. He came to my room. He looked at me. He says, I think I know why I can't sleep very well in my room. I can't breathe very well. And he mentioned the stuffed animals. He said, I think it's dirty because of the stuffed animals. Like, oh my gosh, that's so interesting that you were thinking about that. But our kids,
it's so hard to clean them.
It is. Oh, anyways, yeah, we got to find something with our stuffed animals, but I'll share here with you guys.
But a good tip is just have a small play area outside the bedroom and just keep them there, because you want to sleep in an area where it's just, as much as possible, away from the dust.
And I do have what are those air doctors, the air purifier in my room. I'm going to move it over to his room. And we do have carpet now, and I haven't had carpet in my house for 15 years. And I noticed that as soon as we had carpet in the bedrooms, it's a new home that we got. Our breathing is already affected. So I am going to actually make those changes when I'm able to.
My rule is no carpets in the bedrooms.
I know. It's so difficult. Here in the United States, especially, we feel like it's so comfy. You can step without shoes, and it's warm.
It's true. Carpets are cozy. It's true.
Yeah. But it's a big deal.
But it's all about habits, right? Once you get rid of them and then, you live for a year, then you feel like I don't really need this.
100%. I mean, I haven't had it for 15 years and it was like, oh my gosh.
Yes.
Anyway.
I want to ask you something.
Yes.
So I would love it if you enlighten us a little bit about the use of cups in toddlers. So what do you recommend, and what do you think about, because for me, I tell parents to throw in the garbage those 360 non-spill cups, right?
Yeah.
So I want your 2 cents about cups. Like, if you're a new mom listening, what would you buy, right? And what would you buy? Because there's so many cups, right? You go to baby store and you have 10,000 types of cups. So moms are just lost.
Mm-hmm.
So to train, to have a great tongue, right? To healthy tongue, a healthy jaw function, what cup would you buy?
Oh my goodness, that's such a great question. We are, for some reason, under this thought that children, first of all, really need bottles. And then from bottles, you go to the sippy cups. And of course, as a parent, oh my gosh, I need to use anything that's not going to spill. If all you're giving your child is either formula and breast milk and then / water, if they have a cup with water and the water spills, it's not that bad. Now, if you're giving juice and things like that we don't usually recommend, yes, we're worried as a mom because it's going to be sticky and all that stuff. Benny and Zoe both did not take a bottle. And I used to put the milk in little tiny cups, and they drank from cups. You'll be surprised how much your young baby or your toddler can learn how to drink. So what I usually recommend, to me, the best thing, it's an open cup, a regular open cup, not heavy, easy to hold. Have your child sit down to have their drink, hopefully water, and not worry so much about having water in the living room, in the car, in these different places where they can totally wait, like until they sit on the table and they have a drink. In terms of 360 cup, and with both of my kids, I tried everything that was out there to kind of see how they were going to do. And the 360 cup, if you notice, whenever they drink out of that, they are forcing their muscles so much more. So they're contracting these muscles way more than they're supposed to whenever they are taking a regular sip. So for that reason, I'm not a huge fan of those.
But also, they're not working their tongue.
Exactly, no.
The tongue doesn't work in a 360 cup, right? They're just the lips.
Yeah, they suck, and then, swallow everything.
Exactly. And you would be surprised how much toddlers, they learn so fast. They're fast learners.
Yes. And I'm one of those that, like, if I find something that I really like, I buy like 10 of them. I want to have. And let me tell you how many Camelbacks I had for Zoe. I had one on every collar. They were the cutest things because as a mom, what was I looking for? I was looking for one, a cup that was not going to spill, and two, a cup that was easy to clean. Because how many cups out there? Oh my gosh, there's so much mold. There's stuff you can't clean inside the straw and all those things. It's so difficult. There's so many little tiny parts. So the Camelback to me was one of the easiest to clean. And the issue with the Camelback is that it has a thick, wide straw with a slit in the middle. And in order for the water to come out, they have to bite on it. So that already is causing your swallow to be dysfunctional. The proper way to swallow is to have the straw be in front of the teeth. The straw should never pass the teeth at all. Lips around the straw. That's why puckering and practicing this pucker, it's great to teach people how to swallow properly. And then like that, they can suck the water in with the force that they have with the correct muscles. And then the tongue, there's nothing inside the mouth besides the tongue and the liquid that's going to allow the tongue to make that beautiful peristaltic movement to get all the liquid swallowed. However, if you notice any issues with your kids like that, it could be that they have a tongue tie. It could be that they have low tone. But yes, that's my 2 cents in a cup. If you can do open cup and start early, start just practicing with them. You're going to be surprised. Like with Benny, I used to do this thing where he has to pour things into the cup. And I'll be so scared. Oh my gosh, he's going to spill everything everywhere. And he's like great at it now,
Exactly. My 2-year-old, she drinks from a glass cup and she doesn't even break it, because she just practiced it, early in life. And so open cup and straw in front of the teeth.
Yeah.
And also what I say also is to parents, especially new, because typically new moms, they always want to go by the book, right? Yeah. And they're always scared of like spilling and things, but I always tell them, let them spill. You know what I mean? Let them, it's also, we also forget sometimes to just enjoy the mess.
Yes.
Right? Because that mess is part of them learning and failing and learning and failing. Yeah. But sometimes because you feel like the modern society, like, oh no, we can't spill, we can't make mistakes. But I think it's also nice to let them spill.
Yes, I was such a freak when Zoe started eating to keep her clean. In Brazil, we give kids like baths 3 times a day. Like we're such freaks about cleanliness. And I was always wiping her, not letting her get food on herself. And I explained to her the correlation of picky eating with that. And to this day, if I ever say anything, Zoe, you're so selective. You're such a picky eater. If I ever mention anything about her not wanting to try things, she's like, you made me like that because it didn't let me get dirty. So yeah, let your kids get messy. Get food should be fun.
Yes, all over their face.
All right. What is the one message you want every parent to walk away after listening to this episode?
Oh, so many messages. Thank you for having me. maybe it would be that healthy faces are not created, they are guided. So I think this might be the strongest message today, that the more you're aware of the habits or of the elements of the face of your child and of their breathing, the more you help them to have a guided, healthy growth. Because and the more you get to your healthy milestones, one after another, I think that would be the best message that we can take away today.
I love that. Before we go, can you share with everybody how can they find you? How can they get your book? How can they make an appointment? And then about the academy, if you don't mind.
Oh, so you can find me on social media at Dr. Tayara. And I'm practicing at the moment. I have Junior Dental, my clinic in Dubai. You still need to visit it. And I also started a very beautiful practice in Netherlands, if you're in Europe somewhere. And we launched the Pediatric Academy last year. That is a website for online education, mainly for parents and for healthcare professionals. So stay tuned. Lots of information coming soon.
That is wonderful. Thank you so much. Someone on Instagram asked about sleepwalking. I am going to leave that question for a sleep doctor, and I'll post it in my story. So guys, stay on the lookout for the answer to sleepwalking, how it's related. But thank you so much. This was so much fun. I cannot wait. And yes, next time I come to Dubai, I'll definitely come to the clinic. It was a quick trip, my first time in Dubai, so I cannot wait to come back. It's such a beautiful place. But thank you. Have a wonderful day. I appreciate you being here, and we'll see you soon.
Thank you for having me.
All right. Thank you, guys. Bye.
Good night.
Thank you for joining us on another insightful episode of the Beauty of Breathing podcast. Make sure to join the conversation on our Instagram page, Maya Moves, and continue exploring the fascinating world of airway health with us. Until next time, let's breathe deeper, live fuller, and discover the beauty in each breath. Quick disclaimer: the Beauty of Breathing podcast has been produced for entertainment, educational, and informational purposes only. All of the content, views, and opinions shared by our hosts and guests should not be a substitute for medical advice. Please consult with your healthcare professional for any medical questions.